Good afternoon and good morning for those in Asia. I am Gyuk Shin, Director of the Schoenstein Asia Pacific Research Center here at Stanford. So this is the first in our webinar series this quarter under the theme of the United States in the Biden era, views from Asia. Now, many in Asia were anxiously watching the US elections and their aftermath last winter. So now we have a new administration that is expected to be quite different from the last one under President Trump. So this quarter, we will be discussing how Asian countries perceive the United States under President Biden and what they expect regarding American politics and policy from economic recovery from the pandemic to ongoing conflict with China to restoration of multilateralism, and what these perceptions and expectations can mean for US-Asia relations. So now we'll show you our schedule on the screen, and you can see the rest of our event under this theme this quarter. So today our focus is on health policy, looking at Chinese views of US-China cooperation on global health in the post-pandemic era. Karen Eggleston, director of our Asia Health Policy Program, will moderating today's panel, and she will be introducing the speakers shortly. Before that, I'm really delighted to introduce Ewa Tran, the Chief Program Officer and Chief of Staff of the George H.W. Bush Foundation for US-China Relations that is co-sponsoring today's event. So once again, welcome all of you to our event. Now, without further ado, let me now turn to Ms. Tran. Thank you.
Thank you so much, Kiwook, and thank you everyone for joining us today. On behalf of the George H.W. Bush Foundation for US-China Relations, it's my great pleasure to welcome everyone to this webinar on the very timely topic of how the United States and China can build back better after COVID-19 from the perspective of three Chinese public health experts. The mission of the Bush China Foundation is to advance US-China relations in ways that reflect the ethos, spirit, and values of President George H.W. Bush. At the foundation, we develop innovative programs to better understand and realize the potential for US-China collaboration on global public health to the benefit of people in both countries as well as the world as a whole. Thank you so much to Karen Eggleston and your colleagues at Stanford for spearheading this webinar. And thank you also to our esteemed panelists for joining us at this relatively early hour in China. I look forward to all of your remarks and to the discussion. And with that, I'd like to turn the time over to Karen.
Thank you very much. And thank you all very much for joining us today. We're delighted that you were able to take the time, and we hope you are well. And we're particularly delighted to welcome our three PRC experts to share their views on how China and the US can build back better and leverage public-private collaboration and cooperate bilaterally to promote global health. And the importance of this is clearly underscored by the ongoing coronavirus pandemic and will continue to shape our globe and well-being over the 21st century. So our first expert is Dr. Xiaofeng Liang, who's Executive Vice President and Secretary General of the Chinese Preventive Medicine Association. Dr. Liang earned his medical degree and master's in public health in China, visited Florida in the 1990s, and has held many prestigious positions in population health in China, including in Gansu province and at the national level as Deputy Director of the Chinese Central CDC and Director of its immunization program. Dr. Liang's research in public health led to advances in immunization and vaccine preventable disease control in China. He's also the author of more than 30 articles in leading journals such as Lancet and New England Journal of Medicine, the winner of several awards, including the 2013 Wu Jieping and Paul Janssen Medicine and Pharmacy Award, and recognized by the Ministry of Health of China for outstanding contributions. For over a decade, he's also been a member of the Global Strategy Advisory Group of Experts on Immunization of the World Health Organization. I could go on, but I will leave it there and just introduce our next two speakers as well. So second, we will hear from Dr. Ying Cao, the China Country Director at Vital Strategies. She leads the team to strengthen local public health systems through Vital Strategies' global initiatives called Resolve to Save Lives that we'll hear about. Dr. Cao earned her medical degree in Shanghai and master's degree in public health in the Netherlands. She has many years of experience in health and nutrition, having worked previously with Save the Children, elsewhere within the nonprofit sector, and 5 years as a physician at Shanghai Ruijin Hospital. And our third expert, finally, Dr. Gordon Liu, professor at Peking University, will share views about the US and PRC health systems. Dr. Liu is a leading expert on health economics and health policy reform. He serves on the China State Council Health Reform Advisory Commission. He is president of the Chinese Society of Pharmacoeconomics and Outcomes Research, served as president of the Chinese Economist Society, and has served as editor for several health economics journals. Prior to joining Peking University, Dr. Liu was a tenured professor at the University of North Carolina at Chapel Hill, and is no stranger to California, having also taught at the University of Southern California. So thank you to Dr. Liang, Dr. Cao, and Dr. Liu for joining us this morning in China, evening in California. And to our listeners, while our three experts share their initial thoughts, please feel free to put your questions in the Q&A and I will moderate discussion afterwards. So Dr. Liang, over to you.
Good morning and in Asia and good evening in US, California. My name is Xiaofeng Liang. I would like to share some information from China for my background for the career. My topic is the post-pandemic health policy and the global public health cooperation. I will like to share some of the COVID-19 control in China and another countries, Vietnam, is quite successful. And China's vaccination strategy for the COVID-19 and public health system and the Healthy China 2030 plan and the aging health and the global public health cooperation. Maybe just some slides. Yeah, that's the latest data. We have cumulative infections of the COVID-19 is 90,000, and unfortunately, 4,600 people died from the COVID-19. Chinese mainland reported 21 new COVID-19 cases on Sunday. Among that, 10 locally transmitted in Yunnan province, bordering with Myanmar. That's the update date for the COVID-19 in China mainland. Two stages of the COVID-19 pandemic in China. The first stage is the contain the virus national mobilization. That's the Wuhan, Hubei, and the other infected area in China. You can find for the last last year from the January to the March. It's the very, very serious problem occurred in China. And then some cases imported from outside and different size of the outbreak occurred in a different area in China. But right now, the controlling situation is quite good. In many measures we conducted for the prevention and the control in China, national mobilization, society-wide efforts, and stick together and took on the challenges in solidarity. You can find, let me read it, extended the holiday, because the Spring Festival we extended to 10 or 2 weeks and reduced the crowded gatherings. And the third one is how to mask wearing and body temperature screen and lockdown, not only in the big city, but also the villages. And restriction on the movement in the highway, airport closed. That's the everywhere. And also for the Dr. Wang Chen, somebody they create a good idea is for shelter hospital building and for the concentrated quarantine and for the PCR testing. And we call some physicians and nurses from a different area to support the Wuhan and the Hubei. Totally is the 40 staffs to the Wuhan and the Hubei. Another very important measure is for solidarity, because we need a very strong support from the volunteers and local social government to some people locked down at home. So that's very, very important. Many countries, they cannot conduct this measure. And another country, some weeks ago, we shared this information with the Vietnam colleagues. Very interesting. They are very outstanding, good student for these lessons. So you can find only 1,000 and less than 2,000 cases occurred in Vietnam, and you can find they controlled the curve is quite good, and some of the measures that they conducted. One is directing the operation, strong political commitment and leadership. And some they decide and earlier and establishing the National Steering Committee on the COVID-19 prevention. And also is some effective measures to conduct it: testing, tracing, travel restriction, and the quarantine and isolation, infection control. Very important for mottos: force on the spot, command in the place, vehicle in place, logistic in place, good prevention and treatment, communication and information technology applications. That's almost like China. We use the mobile to tracing and many things they conduct is quite good. For vaccination for COVID-19, we started. You can find from these slides as the April 4th this year, a total of the 139 million doses of the COVID-19 vaccines have been administered in China. Basically, province of the vaccination is on the premise of the voluntary informed consent. The main factors affecting the vaccination is the awareness. The prevention and the control of the COVID-19 in mainland of China is quite good. So the people, they don't have the very interest on the vaccination of the COVID-19. That's a big problem and the hesitancy. And somebody are still worried about the safety and the effectiveness of the vaccine of the COVID-19. That's 5 products of the vaccine. If you have interest, I can share this for you. Another topic is the system, especially for the public health system in China. This system, this time, conduct a very important role for the prevention and the control of the COVID-19. Left line is the administration system from the national, provincial, city level, and the county level. They have the health bureau and the commission. They're the steering committee, just like my slides mentioned. And the middle one is the CDC system. We have 4 levels: China CDC, national, and the provincial, city level, and the county level. They conduct a very important technical support for the government and the hospitals and the clinics. Right side is the many academy, is like universities, hospitals, So this whole our public health system in China. But the bottom is the township and the village level for the clinics. You can find from these slides public health services, hospital, community, CDC, like other countries, almost the same. And let me introduce very briefly for the China 2030 plan for healthy China. Overall guideline is here is focus on the grassroots, pursue reform and innovation as a driving force and disease prevention as the priority, give importance to both traditional Chinese medicine and the Western medicine, incorporate health into all policy making, and strive for participation by all and benefits to all. We have a 15 special campaign for healthy China. You can find some of the three category. One is the intervene in the health influencing factors like health knowledge, popularization, and responsible diet, national fitness, tobacco control, mental health promotion, and health environmental promotion. That's the influencing the factors control. The second kind is the protect full life circle health, maternal and child health, health promotion in primary and secondary school, occupational health, and the elderly health promotion. A third kind of the measure is the prevention and control major diseases like the prevention and the treatment, HIV, tuberculosis, and some things like this. Yeah, one very important issue topic in currently and the future is the aging. Just like other Asian country like Japan, South Korea, and the US, and many of the European countries, China will be the aging population. As the end of this year, there will be close to 300 million elderly people over the 60 years old, accounting almost 20% of the total population. So China takes protecting of the health right and the interest of the elderly as the starting point, actively respond to the aging of the population as a national strategy right now. And China, we are working together with the other countries' experts. Many activities occurred after the COVID-19 pandemic occurred. So we discussed with many countries like European, WHO, and Asian countries. One is for COVID-19 vaccination strategy, and the second one for infection prevention and control in hospital environment in the context. My organization, we held this meeting, and we will have another meeting for occupational health and safety for health workers in the context of the COVID-19 in the next week. So that's my slides. Thank you very much to your attention. Thank you.
Great. Thank you very much, Dr. Liang. And next we will have Dr. Cao.
Thank you, Karen. Good morning and good afternoon. My name is Cao Ying. I'm the country director of Vital Strategies in China. Resolve to Save Lives is one of the global initiatives of Vital Strategies. I will share some experience of Resolve globally and locally today. During the past 1 year, what we learned from COVID-19 is the pandemic kills more than 2 million people around the world. It also costs estimated $20 trillion US. Coronavirus and other infectious disease agents do not care about governments, ideologies, or borders, but politics in the fight against disease can cost us lives and money. It is true that health protection is not free, but it is the best buy. For an investment of $1 US per person per year in low-income countries, the world could both better respond to the impending pandemic and prevent the next health crisis. Working together, we will take a giant step toward being able to find, stop, and prevent health threats faster in every country through the public health systems that are understood, supported, and celebrated. Resolve to Save Lives is a global initiative led by Dr. Tom Frieden, in-house by Vital Strategies. In the past year, Resolve helped the world better understand and more effectively respond to COVID-19. COVID-19 revealed stark and unacceptable gaps in our public health and primary health care systems, and also validated Resolve's approach to help to close these gaps. Our Prevent epidemic team provides technical assistance to at-risk countries directly or through partners, mobilize resources to support preparedness, and catalyze political will to address these gaps. Resolve's mission is to save 100 million lives from preventable diseases globally over the next 30 years. Before the pandemic, cardiovascular disease is the biggest killer of people in their prime years. Each year, about 3.8 million people aged from 15 to 70 die from communicable diseases globally, and 6.3 million from cardiovascular diseases. Our cardiovascular health team focuses on increasing the global control of hypertension from 14% to 50%, reducing global dietary sodium intake by 30%, and eliminating artificial trans fat in our food supply. Given the dangerous synergy between COVID-19 and NCDs, addressing these issues may now save even more lives. Now I would like to introduce some key elements Resolve promoted globally. We believe we can successfully reduce sodium through support for low sodium salts and condiments for home cooking, and policies and legislations to reduce sodium in packaged or institutional prepared foods. We support the WHO's Replace Action Package. This is the first action package, provides a step-by-step guide for the elimination of industrial produced trans fat from the global food supply. In hypertension, the WHO's HEARTS package offers a great example of ways to simplify algorithms and enable sustainable care. COVID-19 is actually pushing us towards a strengthened primary healthcare system and the person-centered care model, especially for people living with NCDs. At Resolve, we think one way to build resilience in the face of COVID-19 and future pandemics is by improving population health overall, through investing in nutrition policies and other key actions that can prevent NCDs. China has continued to promote the Healthy China 2030 initiative to safeguard people's health, including the medical and health system reform, the National Medical Insurance Bureau setup, and so on. According to the 14th five-year plan, the Chinese government will heighten its emphasis on reform of the public health system, disease prevention, and supplies of all-around full-cycle health services. Resolve in China works closely with government partners, research entities, and international organizations to build capacity for and implement a core package of intervention to reduce cardiovascular diseases. We support our partners to address sodium intake through comprehensive intervention plan and promote and test decentralized and patient-centered healthcare model in hypertension management. Last but not least, I'd like to say, take action must be more than a slogan. Strengthening national health architecture will require country commitment and effective governance, effective use of increased financing, robust technical support, and the support of strong and accountable cross-sectional leadership. Success will also require a stronger commitment to collaboration and new ways of working together that recognize the reality of our mutual dependency and of the need for mutual accountability. Thank you all for your time. Over back to Karen.
Great. Thank you so much, Dr. Ying Cao. Our third expert today, Professor Gordon Liu, over to you.
The first talking point I'd like to discuss is the role of Healthy China 2030 and its relationship with the ongoing the national dual circulation economic approach. As we all know, in 2016, China initiated Healthy China 2030 plan, which is a very comprehensive national health plan, considered to be a national top priority development strategy. Among others, Healthy China 2030 plan made a very strong call for transformation from the disease-centered medicine, which is basically what our current health system is about, to health-centered care service system, which in my view would promote what I would call the 3F model development. That is full life cycle health management for every individual, full population engagement in health promotion, ranging from infant health to elderly health, from disease population to health population, and full sector cooperation for population health, because Minister of Health or National Health Insurance Bureau, CDC alone cannot reach the goal we set without the cooperations from other sectors, including like environmental sectors, agricultural sectors, transportation sectors, etc. So we call for full sector cooperation for population health. Looking back, the Healthy China 2030 is a very right national initiative today, more than ever. Why? Because if we do follow Healthy China 2030 initiative and take actions, that will serve not only for national health, but also for national economy as a central driving force for promoting domestic aggregate demand, which is a core component of the national dual circulation economic growth model. If we look at our aggregate demand structure, our economy, including investment demand component, consumption demand, and export demand, we know the investment component has been invested for years, which is indicated by decreasing returns of investment in China. So we cannot continue to rely upon further investment in our infrastructures and many other projects as the leading driving force for economy. But when we look at the consumption component, that is about just over 50% in China. But as compared to many other countries, this consumption component still has quite large room for further improvement. Now, among the consumption component, over the past several years, according to the National Statistics Bureau data, among the major consumption items, healthcare is perhaps the only one component that has indicated continued growth over the years in terms of its relative growth rate in a aggregate consumption function. But that is quite consistent with what's being found in the US and European countries based on more than century data, right? Healthcare consumption has been a very strong consumption item. If we look at some statistics reported in the US over the last 20 years since 2000, healthcare service in hospital, for example, is the most inflated service as compared to all other product and services, which partially explained why healthcare demand would continue to be a very strong demand in any economy. For China, that's more important, I think, for now. So that's my first talking points. I hope we will continue to take actions following the Healthy China 2030 roadmap. So that will really serve many goals that, as we set for China. My second talking points is about more micro policy, health policy. For example, while we promote so-called value-based medicine, we are confronted with specific actions from government standpoint for actions like whether and how to price medical products. Shall we focus more on national pricing on medical services, including drugs, or not? Or shall we more focused on disease level payment or even higher tier payment models? In 2020, last year, 2020, Chinese National Health Insurance Bureau conducted an annual updating work for National Health Insurance Formulary. I myself participate in this work as too, and we did spend a lot of time and efforts together with many other scholars to determine how the National Health Insurance Formulary would include most appropriate medicine in it. In the meantime, we are also struggling with pricing of this specific of these individual medicines. So I think that's an area where China and the U.S. probably can share their knowledge, their research findings as to whether or not or how can we price individual medical products, or should we focus on something different at a higher tier level rather than focus on specific medical products and services. Another point associated with this point, this topic is how can we promote preventive care payment using the funds from basic medical insurance, because the medical insurance facilities are subject to the budgetary constraint every year. So their goal is primarily to serve our medical needs for diseases, right, of the population. But if we call for preventive care payment from their budget, and how can they balance the needs for the current curative services and also the future return from preventive care? That is a quite real challenge for them. So I think that's something we probably can discuss and share our two countries' experiences and lessons, so that we can both benefit from these kind of communications. My third talking point is on the role of digital health and COVID-19. As Dr. Liang presented earlier, COVID-19 is a great cost to the world. But in the meantime, we all know COVID-19 may also have provided great opportunities for the world to learn things that we would otherwise would not be able to learn. At least COVID-19 provides such a great opportunity for both the public and the policymakers to reassess the medical care or preventive care for both non-communicable diseases and infectious diseases, right? And also, COVID-19 provides great opportunities for the public and policymakers to better value and use online medicine, mobile health, and AI and machine learning. In China, Minister of Health system has been very careful in promoting online medicine, telemedicine. But because of the COVID-19, I think the whole society has been more open than otherwise to the use of digital health, especially with mobile health and, telemedicine. I think digital health is a great revolutionary driving force for medical innovation, such as the very fast development of COVID-19 vaccines, right? Cooperation and collaboration domestically, nationally, and internationally, even though we do face great challenges about how to better communicate and cooperate between countries. I think digital health is something we really should pay more attention than otherwise. However, digital health or online medicine, mobile health, and AI do face some challenges. For example, they are more associated with state health information security. How do we deal with that? And also, they are more associated with the individual privacy in access to data. Actually, I had a meeting yesterday with some people discussing this topic, and we are so much concerned about the balance of the data security and access to data for better healthcare development, research, and the sharing of the information worldwide. I think that's something U.S. and China could have better dialogue to see how we can move forward to improve the access to health data for health technology innovation. Well, in the meantime, making sure that national health security, individual privacy can be preserved. I think those are the great opportunities and challenges as well. So those are my 3 talking points for the audience. Back to you, Karen.
Great. Thank you so much, Gordon, and all 3 of our speakers. So we do have some questions that have come in, and I've curated some from others who are not able to join us live. So in the remaining 15 minutes of our webinar, we'll take some of those. So Dr. Liang kindly already answered in the Q&A one of the questions, but maybe for the benefit of our recording audience that will not be able to see that, perhaps Dr. Liang could respond live briefly. The question was related to the rollout of the vaccines in China and about who is eligible at what point and why. Dr. Liang?
Yes, good question. Many people ask these questions from outside because one major reason is that we don't have the epidemic of the COVID-19 right now. So we don't need a very urgent to the elderly people because we are top priority people for the vaccine. The target is for the public health workers. That's if you are public health professional, you can understand that. But right now is we will open the door and we'll vaccine the elderly people from the 60 to 65 and more elderly. That's already started. Another reason is due to the limitation of the production of the vaccine in the earlier stage. So we don't have sufficient vaccine for the every people. So we have to select the priority groups. That's the important. And then for with some conditions like chronic diseases, they're all still very hesitant. One reason is that we don't have the much sufficient data shows for the safety of those people. Another one for the local staff, they don't want to vaccine this group because still very co-incident rate is very high for this chronic disease conditioners. That's my answer. Thank you.
Thank you very much. And we'll go on to the broader questions of Healthy China 2030 and the health system in a minute, but just to stay with the pandemic and the response, both for this pandemic and maybe to help prevent the future one, it's useful for both countries to reflect on what has worked and what has not. And we've had questions coming in about travel, for example. So in the early stage of a pandemic or later, now that there are vaccinations, and Gordon also mentioned telehealth, there are questions about vaccine passports. I would invite your thoughts, Dr. Liang, and then also the other two experts. Do you have ideas about appropriate travel policies? So for example, at the beginning, many countries very proactively reduced travel domestically or internationally, but should countries have prevented, maybe, I don't know if the questioner is asking, should China have prevented Europeans from going home to prevent the pandemic from spreading? So there's a question about the early stage of the pandemic, whether travel restrictions and how strict those should be. And currently, with countries rolling out vaccines at different rates, what should be the travel policies related to that? Dr. Liang, do you have any thoughts you would like to share?
Yes. Yeah, for the first one is I saw the question. Restrictions is quite hard to policymakers. One, depending the WHO, IHR, they have every country they have a responsibility to transparency and report the case to the WHO. But for the restriction for the travel is the own responsibility of your country, not the other country like China to the some other countries. I remember H1N1 10 years ago occurred in Mexico and the US. We conduct restrict policies in China. We close the travel from the some Mexico to China, and some is the US. I cannot remember very clear. So that's the own responsibility of your country. That's my answer. And for the diploma, for the what's the passport for the vaccination, I don't agree with use this word. We have to discuss with the WHO. They should take this responsibility. Just a certificate of the vaccine. My organization, CPMA, already discussed this issue, and we, maybe 2 months ago, we already conduct a search and create a standard for international one for the United Nations languages, five kinds of the languages, but nobody accept our standard. Should be the certificate of the vaccination of the COVID-19. But it is still very hard to make this decision for every country because the efficacy of the vaccine is limited. Maybe some is even it's 90%, the 10% of people will fail for the vaccination. How to select these people from the 100 people for the 10 people? It's very hard. So for the policymakers, it's very hard to make this decision. Somebody tomorrow we have a meeting with the Israel people. Their coverage of the vaccination rate is very high, but still some people they unvaccinated, and if they want to travel, just take this certificate is enough or not? and test the PCR. So that's very hard to make this decision. The WHO, I know, already discussed for this issue many times, but they don't have the final decision for every country. Thank you very much.
Thank you so much. And next, maybe we'll go to some questions related to the healthy China and other kinds of behaviors to promote healthy aging. There are some questions that came in about how to promote a low sodium diet and whether Vital Strategies had worked with app companies or restaurants to promote that. I don't know if Dr. Ying Cao would like to respond to that, and more broadly to sort of what are the priorities and effective strategies that have been shown to work for promoting a low sodium diet, and what the impact would that be on healthy aging, healthy life expectancy in China, if we could do that.
Thank you. And thanks for the question. I think this is a $1 million question. And for the short answer is yes, we do. We are not only do by ourselves, and we work with a global and national level and the provincial level partners to achieve this goal. For one example, we work with WHO to testing the possibility to work with the delivery services, especially for the digital applications companies, and to mobilize the restaurant to work with us to like develop and invest into the low sodium dishes, and for the second to educate for the restaurant to practice, and also to encourage the application company to promote these kind of dishes. Yes, we do. So back to Karen's broader question is, actually we all know that before the pandemic that the cardiovascular disease is the #1 killer around the world. The facts in China actually is very challenging. And through the graduation of the economic development of the China society, the aging population is a big issue for the whole society, and we need to keep the whole population much more healthy and safer. I think that's the one of the many more reasons that the government determined to promote and implement the Healthy China 2030 action plan. And what we do is to support our partners to achieve these goals in terms of technical support and provide and maybe sharing the global common practice, and through the working panel among the national experts. And for one thing is keep working with them to do the public education work, because in terms of the dietary behavior, it's related to individual person. But on the other hand, Resolve and the Vital Strategies are very keen to improve the policy, especially in the nutrition domain. For example, we are working with our partners to promote the low sodium salts, and also to promote, working with WHO to promote the institutional or food supply for the low sodium products. So for Vital, there's always two ways to achieve the final goal. For one thing is to set up policies to establish a enabling and friendly environmental for the healthy diet. And for the other hand, we are continuing to work with different partners to provide education to the general population, to improve the awareness, also or improve the practice, and to make the reduce the sodium in daily diet will achieve. Thank you. Over back to you.
Thank you very much. And Gordon Liu, our third topic then on the healthcare system and some of the issues that you had raised. Gordon Liu, I wanted to ask you, you mentioned pricing of products. You may know that there's controversial policy about pricing transparency in the US and how effective that would be for addressing the misalignment of incentives. And you also mentioned the budget constraints related to formulary and so on, as well as digital health. So I have two questions I wanted to bundle for you, Gordon. One is, can you talk a little bit about the trade-offs in pricing policy and actually to the extent that cost effectiveness is used in coverage decisions and deciding about formulary or whether it should be, how that's rolling out in China and the US, since you know the two systems. And related to that, digital health and its role within the health system, whether it's included through insurance reimbursement. What is the current status of that in China and plans for the future in both countries? Do you have any thoughts on that, Gordon?
Yeah, thank you, Karen. This is a question that we discuss all the times in and outside of classes. The trade-off between pricing of individual products and better payment for healthcare services in bundle. Now, when we're talking about the pricing of medical services, including drugs, we are talking about the state intervention in pricing of individual products, so that the market demand and supply for that particular product won't play much role because government is trying to put a price tag on it. Okay. Now, as soon as government put a price tag on each individual product and service, and then how are you going to then promote the better comprehensive payment to health services in bundle, for example, by DRG, by capitation? Okay, because you basically it's very, very difficult, if not impossible, to figure out a price of a specific product in terms of the value and contribution to healthcare, because you really have to put all kinds of services together in order to determine and deliver the value to the patient, not one single product, which is in economics called a factor production. So in my view, my personal view, I could be wrong and people can disagree with me. I think for individual product as a factor production, we should leave that to market demand and supply to determine. But the government intervention, health policy said, should be at the level where we focus on the value of the services in bundle in corresponds to specific disease category or therapeutic areas. So if the government focus more on a higher level, at least at disease level, while leaving the price of specific technology to the market, I think we probably would be better positioned than where we are. Because right now we are like, on the one hand, we try to price for each individual product. On the other hand, we try to set a payment for disease level services. That is why we are confronting so much challenges. So that's just a quick thought.
Thank you, Gordon. Yes, we're almost out of time, so I'll throw out this final question to each of our speakers in the same order, Dr. Liang, Dr. Cao, and Dr. Liu. The question is, recommendation to young people among those listening today, if you were going to give advice, if they were thinking what career can they join or develop in that will contribute the most to long, healthy lives for the fifth of humanity that call China and the US home, what should they do? Should they go into politics to promote global health cooperation? Should they become physicians and nurses? Should they become health economists? Should they do other things in NGOs in the private sector? What would be your words to young people?
I started my undergraduate study in medicine and then transferred to public health. For me, public health is always amazing area. You can reach out to everything related to your daily life. So I personally would encourage everyone to join the sector. And but everything related to public will not be a money maker business. So yeah. So but anyway, you I think everybody can find their spot in the public health sector and related to your interests. So that's from my heart, actually. Thank you, Karen.
Thank you. Dr. Liang, would you like to share any final thoughts, recommendations to young people about how to make a difference?
Yeah, not only for the COVID-19 prevention and control, also for the NCDs, just the Cao Yang mentioned, Tom Frieden, also my friend, he support us to do more salt reduction in Shandong province and the future cardiovascular disease and the cancer prevention, quite hard the disease burden for Chinese people. So we should exchange more information and the technology with US and other countries. So for my career, I believe the COVID-19 will be over. But for the NCD, cardiovascular disease and the cancers, and like the tobacco control, alcohol control, environmental pollutions, many things we need to deal with together in future. I hope your Stanford University and the Bush Foundation and other foundation like Gates Foundation supported many years for Chinese institutions. We should working together, fighting the diseases and other like the negative influential factors for Chinese people and US people. Thank you very much.
Thank you all so very much. Gordon, I know you're back now. Sorry we missed your final thoughts. Something you wanted to add?
No, I just said I would highly encourage our young fellows to consider health policy, health management, health economics in particular to be your great choice for your career development. You would never regret.
Well, thank you all so much. And we hope our audience as well, and that you'll take some of these ideas to heart, and that our cooperation can help to get us past the pandemic into the future. We have to try to look beyond the current tragedy and think of hope for the future. So thank you so much, Dr. Liang, Dr. Cao, Dr. Liu, and thank you all for joining us.